This month on The Spark, our theme is responding to COVID 19. We're taking a virtual approach to talk with an doctor who shares some perspective on what our hospitals and medical professionals are experiencing and how they're responding. An organization helping to educate the public on coronavirus scams that are popping up and how we can avoid them. And a bishop who discusses how the faith community has been impacted and how our dioceses and churches are responding to lift our community. We'll also share a special moment from our Spark Awards 2019.
Lipscomb and Pitts Insurance is honored to serve the Memphis community for over 60 years. We've always focused on supporting our community and believe in promoting the positives, encouraging engagement, and leading by example. Lipscomb and Pitts Insurance is proud to be a presenting sponsor of The Spark.
Additional funding for The Spark is provided by Christian Brothers University, Mueller Industries, YMCA of Memphis and the Mid-South, Meriton, United Way of the Mid-South, MyTown Movers, MyTown Roofing, MyTown Miracles, Stuart Lloyd Cohen, Chief Motivation Officer, and by Serves.
Ever been excited by a new idea? Inspired by watching someone lead by example? When we talk about creating change, we start by sharing the stories of everyday heroes making a difference in their own way so we can learn and do the same. This truth is the power behind this show, which is focused on business and community leaders who are leading by example to give back, fuel change, and create new opportunities for the Mid-South. I'm Jeremy Park, and this is The Spark.
She and her team are on the front lines battling COVID-19. We greatly appreciate her team, all of our first responders being so brave. We're joined by an emergency physician with Baptist Memorial Hospital DeSoto, Dr. Kimberly Brown. And let's start, Dr. Brown. Once again, thank you for your service, for you and your team and all of our first responders. Give us a little bit of a day in the life, though, so we understand your role and kind of your efforts on your end.
Well, first of all, thank you so much for having me back on the show. I really appreciate it. So, as you said, I'm an emergency room physician. I take care of anyone and everyone that walks through the doors of the ER. So, with the current COVID-19 pandemic, we, of course, are seeing some COVID-19 patients coming through the doors of the ER. But more importantly, we're still seeing other emergencies that are going on. I'm still taking care of patients that are having strokes, heart attacks and car accidents, broken bones, you name it. I'm still doing the job that I've been trained to do, taking care of everyone else that has an emergency as well.
Talk about some of the different changes, the protocols, some of the things that you've put in place to make sure that all of the patients are safe and secure and that health remains the top priority.
Absolutely. So Baptist has been doing a lot of different things to make sure that both the staff and patients are staying safe and healthy. One of the things that has been implemented is that when you walk through our hospital doors, you're immediately given a mask. We're asked to wash our hands with hand sanitizer. There's a few screening questions that we are asked before you walk through the doors. You're immediately roomed. There's not people waiting in the waiting room for an extensive period of time. You're immediately going back to a room to minimize kind of the concentration of people in the waiting room, and we're seeing you immediately. Both myself as a physician, my partners, and also the nurses and other staff members are wearing what we call PPE, which is personal protective equipment. That could be face shields, definitely N95 masks, surgical masks. Sometimes we're wearing gowns, paper gowns and gloves as well, especially if someone is suspected to have COVID-19. And then when you leave the room, we are thoroughly sanitizing it before the next patient comes in. And of course, if you are tested and likely going to be positive for COVID-19, that room is actually blocked off for several hours before another patient can come in and be served in that room.
I know that for you, you started wearing like head cover. You're going through different doors now to be able to enter. Talk about some of those changes on your end and just how you and your team are holding up, because I know that some of your team members have lost loved ones as a part of this. And so there is a reality of just how grave and personal this can be.
Yeah, so one of my physician partners lost her mother to COVID-19 a couple of weeks ago. So our staff has been rallying around her. We love and appreciate her. She's a very seasoned emergency medicine physician, and I am so glad to call her my colleague. I look up to her, and we've all been rallying around to support her, nurses, everyone. So our thoughts and prayers always go out to her, but she's back at work seeing patients, and she's back on the front lines doing her job as well. You mentioned that I am usually wearing a scrub cap to work, and I don't typically do that because usually our scrub caps are typically used for sterile procedures or if you're going to be in the operating room. And since I'm not a surgeon, I just don't typically wear scrub caps. But when I get to work, I just want to make sure that everything on me is protected when I get there. And then when I'm about to leave my shift, I actually change clothes into something completely different, bag up my scrubs, and put them in a separate bag, and then go back home in my vehicle in a different outfit. And as soon as I get home, I take off my shoes and I just go straight to the the washing machine, jump everything in, and just take a shower before I do anything else, just to make sure that I'm not bringing any germs home to anyone else that I love and care about.
What are some of the recommendations when you're talking to the public and to your patients, obviously, and their families, and just encouraging safety precautions and obviously the washing of the hands for 20 seconds? What are some of those things that you're recommending for the public?
So right now, even though the city of Memphis is technically phasing back into life as normal, quote unquote normal, I'm still recommending that if patients can stay at home, we really do appreciate if you do stay at home, because as we start to mix and mingle with each other, we just don't know who's asymptomatic or who may be on the brink of, starting to have symptoms. It's just better to stay at home if you can possibly do so. If you are out, please follow the CDC recommendations of wearing a mask, and also monitor the businesses' recommendations of what they would like you to do when you walk through and their doors and patronize businesses. Again, like you said, washing your hands with hand sanitizer with warm soap and water for at least 20 seconds as well. So just doing all of the things that we know to do, but being careful and safe and making sure that you're staying 6 feet apart for right now until we can get our hands around this thing that we call COVID-19.
Share what it's meant to you and your team personally to see the rallies around the nation, to see even locally people stepping up and saying, hey, we appreciate everything you're doing. How has that touched you personally?
To be honest, it's very nice, but it's a little weird because I definitely don't consider myself as a hero, quote unquote. I went into medicine because I wanted to help people and never expected to be in a part of a worldwide pandemic. So the best thing that people can do for me individually of myself is to just protect themselves and do everything that they know to do to stay healthy. So if you were diagnosed with a chronic disease like high blood pressure, high cholesterol, diabetes, obesity, chronic kidney disease, taking care of those things is the best thing possible, because that's going to help you maintain your health and hopefully reduce the chances that you get critically ill from COVID-19. So just remembering that the world is not stopped from anything else going on, and COVID-19, even though it's dominating the media, there's still other things going on that you can prevent and hopefully care for at home yourself with the direction of your physician. Is the most important thing right now.
And wrap up with a couple of websites, a few places that we can go to make sure that we're well informed and stay current with the news.
Absolutely. So I'm personally following the CDC's website. I'm following the WHO. And of course, I'm paying attention to the City of Memphis website, including the Shelby County Health Department, following Mayor Strickland's guidelines and updates that they are giving to us regularly is what I am doing most importantly.
Well, Dr. Kimberly Brown, I know you say you don't consider yourself a hero, but we do. We appreciate you, your team, and all of the first responders. So thank you so much for coming on the show. We appreciate it.
Thanks again for having me.
They're an organization creating an ethical marketplace for businesses and consumers. We're here with the president and CEO of the Better Business Bureau of the Mid-South, Randy Hutchinson. And Randy, let's start. We're coming to you obviously from home studios, but give us a little background, a history lesson for the BBB of the Mid-South.
Well, of course, the Better Business Bureau itself has been around 108 years. We're a nonprofit organization. The Better Business Bureau of the Mid-South covers 28 counties in West Tennessee, North Mississippi, and then Crittenden County, Arkansas. We've got about 4,200 members. We call them accredited businesses because accreditation connotes that they have to meet our standards. And really, if I had to sum up our objective, it's to steer consumers away from bad businesses to good businesses. The vast majority of businesses are good, but unfortunately, it's just enough bad ones. And then also an increasing number of scams that we have to educate consumers about.
Give us a little bit when you talk about the accreditation process and why that's so important to make sure that everything is on the up and up and that businesses are acting ethically and consumers can trust those businesses.
Well, if you can take trust off the table, if you're a business person, take that off the table and just focus on your product, your price, your service, you're ahead of the game. Trust is important to consumers. Members of the Better Business Bureau have to meet our standards. There are good businesses that are not members. We'd sure like to have them all be members. But member companies, accredited businesses, have agreed to meet our standards that involve advertising honestly, meeting customer expectations, delivering on their promises. An important one, if they're in an industry that requires a competency license, we check to be sure that they have a competency license. A lot of consumers want to deal with a member of the Better Business Bureau, and we certainly suggest that members advertise their membership, put our logo on their websites, in their advertising, every place that they can to tell consumers that they've submitted to the Better Business Bureau's standards.
So I know that one of the things right now, obviously, is COVID-19, the coronavirus. There are a lot of scams going on. This is something that you have been pushing out a ton of helpful information on tips to avoid those scams and obviously inform us on what those scams are. So share some of the major ones going on. Let's start with the fact that some of these businesses are advertising not necessarily cures, but things that could possibly mislead and people to think that they're treatments.
Some of them are actually advertising cures. We're all heartened, I think, by the news that, to use the word of the day, we're bending the curve, flattening the curve on infections and deaths. Unfortunately, that just is not happening with scams. And as you mentioned, phony treatments, cures, the Federal Trade Commission and the Food and Drug Administration have sent out over 120 letters, 45 just this week. That tells you that things are still happening, but 120 letters to companies who were advertising products that they said could prevent, treat, cure coronavirus. I'll give you some of the examples. Ionic silver, acupuncture, vitamins, minerals, and oils, supplements, those sorts of things, stem cell treatment, IV therapies, even music and sound waves. And some of these, frankly, it's a big concern of the FTC, some of them start to sound like more legitimate therapies and treatments that may be perfectly valid for other illnesses and diseases, but they sound more legit than perhaps some of the earlier treatments were more like snake oil treatments. And the authorities are worried that people will think, well, they must be legitimate.
I know another big one is the investments. And so looking at both investments on the personal level, but all the loans on the business side. And so talk about what you're seeing on that side.
Well, first of all, the Securities and Exchange Commission put out an alert because they're seeing reports of what's called pumping a stock, basically, that the crooks will say this company is about to deliver on a vaccine and get in early because, of course, the stock price is going to go up tremendously, and you get in, price goes up, they get out. It's all been a scam from the get-go. And then a more common situation, some of these scams, by the way, target businesses as well as consumers, are phony stimulus, phony loans. The crooks may call a person or email them or text them. We've seen all versions and say, we're from the government. We want to deliver your stimulus payment, or we want to deliver your PPP loan, whatever it is. All we need from you is a modest fee, processing fee, or your social security number or some other confidential information. People provide it to them. Most people know better, but enough to provide it to them. That then, of course, they've taken your money or they've taken your identity.
But share some of your favorite tips just to make sure that we're avoiding these, both for the coronavirus, but also throughout time. Give us
you hit my favorite because it's also the most dangerous, which is the phony cures. Check with a healthcare professional before you take any product to treat this disease. On the stimulus, scams. The government will not ask for a fee. They will not ask for confidential information to get a payment. Somebody contacts you asking for that information. It's a scam. There are websites, fraudulent websites selling masks and other vaccines that don't exist yet. Check them out. Be sure they've got a good reputation. Beware of job offers, another scam we're seeing. A lot of people unemployed, looking for work at home jobs or other opportunities. Just be careful if you're asked to pay a fee up front or again, provide information that's just not usual for that kind of a job. And don't be swayed that just because you may see the job on CareerBuilder or Monster.com or they respond to a resume you posted there, doesn't necessarily mean that it's legit.
Yeah. So go ahead and wrap up and talk about where to go, your website. Where do we go to make sure that we can check out everything and be on the up and up?
You can check out a company, file a complaint against a company, file a review about a company. We take reviews also positive and negative. If you've had a good experience with a company during this crisis, file a review at bbb.org. Again, anywhere in the country, you can do that. If you want to talk to one of our staff about an offer you've gotten or to check out a company, of course, you can check out online, but if somebody wants to talk to someone, we're working from home, but we're working, call 759-1300.
Well, Randy, thank you and your team for all you do and for coming on the show.
We appreciate you.
The Spark Awards annually recognize and celebrate individuals and organizations that have made outstanding contributions to the community. This year's recipient of the Corporate Award for companies with between 100 and 500 employees is Buckman.
Buckman was founded in 1945 here in Memphis, and this is the headquarters for the North America Company as well as the Global Company. And we offer innovative solutions and smart chemistry for our customers. Buckman Cares, we actually are in our 10th year of a formal program. We have our 3 pillars: education with focus on youth, and environmental stewardship, and health and human services. We had over 63% of our associates participate in volunteer events, which impacted over 70,000 people, and that was over 5,000 volunteer hours. Buckman has been an adopter of local schools for over 40 years. Our current school that we have adopted is Springdale Elementary, and our associates love volunteering and supporting the students, their families, and staff. And we are involved in so many things there. We have a learning garden and an outdoor classroom, and then we provide backpacks of school supplies to the students and their teachers at the beginning of every year. We participate in career days and STEM days. We also work with Memphis Kids in Nature and providing field trips to farms and areas outside the city so the students can go hiking and fishing, and then also with Wolf River Conservancy and educational opportunities. I think it's a wonderful opportunity for our associates because they can volunteer on work time. And so when they start out their day and you walk into the school and the little children are so happy to see you, and the smiles and the greetings from the teachers as well, and it just gives you a bright start to your day. We do support the Buckman Boys and Girls Club and are involved with the children there and the director. I think seeing how our associates interact when they are volunteering, especially when we have new associates that maybe haven't volunteered as much, and just to see how full they are with the experience and just the smiles on their face in order to give back. I have people say, well, I thought I was volunteering for Buckman, but I am volunteering for myself.
She's the first African-American and woman to serve as bishop with the Episcopal Diocese of West Tennessee. We are honored to be joined by Bishop Phoebe Roaf. And let's start with a little bit of context around what it means to be bishop of the Episcopal Diocese of West Tennessee, and then also talking about some context with the Episcopal Diocese. So, Bishop, how are you doing? Describe your role and fill us in.
Thank you, Jeremy. It's wonderful to be with you and all of your viewers today. So, the Episcopal Diocese of West Tennessee was founded in 1982. Until that time, the entire state of Tennessee was one big Episcopal diocese. So, my boundaries would be the Mississippi River on the west, the Tennessee River on the east, the Kentucky border up top, and the Mississippi state line on the bottom. And as bishop, I'm sort of the overseer, the shepherd, the person who supports all of the clergy as they then carry out their work with the congregations.
You're a part of a group of faith leaders that recently put out a public service announcement talking about maintaining safety, but also remaining spiritually connected. Let's go ahead and watch a short clip from that PSA, and then we'll come back and talk about what you're doing with technology.
As faith leaders, Christian, Jewish, and Muslim,
we will wait a bit longer to gather for face-to-face worship because my choices and my freedom
cannot come at the expense of your safety and health.
The Torah says, love thy neighbor as thyself.
That's why I'm wearing a mask for your protection.
Jesus said, just as you did to the least of these, my brethren, you did it to me. So I'll physically distance to keep you alive.
So talk about technology, because when you look at not being able to necessarily worship in person, you've been instrumental in using technology to make sure that we all are able to still remain spiritually connected.
Yes, even though we have been physically distancing, we have still looked for ways to be emotionally and psychologically connected. Many of my congregations are live streaming their services for the first time. And they're actually having more persons viewing them on the internet or Zoom than they had in their buildings on Sundays. So even as we return to our physical spaces, I think that we're going to look for opportunities to continue serving the online community.
Talk about, I've had a chance to talk to you before, but talk about and share how you yourself are coping through this and where you're finding your center and your peace.
Yes. So I think some people may know, because it was written up in the Daily Memphian, that I even had to self-quarantine. I have my own COVID-19 story. I shook the hand of a priest in Chattanooga, Tennessee, who later tested positive for coronavirus. And so during that time of self-quarantine, it gave me a lot of time to think and pray and reflect. One of the things that has been so helpful is that I live in Midtown, within walking distance of Overton Park. So I have continued to walk 4 or 5 days a week as a means of just releasing stress and connecting with nature and just seeing God's hands in all of the animals and the plants and even the people that I see when I'm walking.
Share on your end the shift of volunteerism, because obviously service is extremely important. That's a central theme for you, for the diocese, for the churches, but it's a little different now. So talk about service and volunteerism now.
Yes, so some folks have returned to the old-fashioned ways of being connected. So they're making phone calls to people who are at home. They're sending snail mail notes. We also have members of our churches who are making masks for the health professionals, and also donating food to be distributed through the feeding ministries at St. Mary's Cathedral, Calvary Episcopal Church, and Constance Abbey. So people are finding ways, Jeremy, to continue to support others in need, even in the midst of this pandemic.
And I know that even on your end, many of the churches involved with room in the inn, and obviously not allowed to necessarily use the space physically, but you're still finding ways to be able to serve meals and do things that are very important to be able to still lift our community.
Yes, most of the Episcopal congregations were doing hot cooked meals where they were inviting our homeless neighbors to come in and be seated and be served in many instances. They've had to transform those ministries to grab and go bags served on tables outside, where persons can come as they're, physically distancing, get their bag, and then go and eat the food at another location.
I know that another thing that you've recommended before too is working with Church Health. Share a little bit of just what you recommend on that side of just getting involved.
Yes, Church Health has many wonderful resources anybody can get involved. If you go to their website, they have a COVID-19 link, and that lets you know about all the activities that they're doing and the ways that you can volunteer.
And then where do we go to learn more about your efforts, the Episcopal Diocese of West Tennessee, the churches that are nearby our neighborhoods? Where do we go to access that information?
Yes, so the Episcopal Diocese of West Tennessee's website is episwtn.org, and that would be a wonderful way for your viewers to learn more about what our churches are doing here in West Tennessee.
Well, Bishop Phoebe Rowe, thank you for all you, your team, your churches, all your congregations, everything you do for our community, and appreciate you coming on the show.
Thank you, Jeremy. Stay safe.
These have been and continue to be challenging times for all of us. We're in uncharted territory with the quarantine, social distancing, working from home, wearing face masks, the economy shutting down, and now slowly restarting back again. This wasn't the episode that we had intended to air, but we felt like it was most appropriate for us to be able to spotlight how our community is responding, coming together to help each other and to power the good. We wanted you to see how first responders and medical professionals are bravely battling COVID-19 and how they're putting our health and safety, and theirs as well, as top priority. There are organizations like the Better Business Bureau of the Mid-South that are working hard to keep us well informed and to make sure that we don't fall victim to a scam. And the faith community, churches, are finding new ways to keep us spiritually connected while physically serving to lift our city. Yes, these are difficult times, but we're in this together, and together we'll make it through. So thank you for watching The Spark. To learn more about each of the guests, to watch past episodes, and to share your stories of others, leading by example, visit WKNO.org and click on the link for The Spark. We look forward to seeing you next month, and we hope that you'll continue joining with us to create a spark for the Mid-South. Stay safe.
Lipscomb & Pitts Insurance is honored to serve the Memphis community for over 60 years. We've always focused on supporting our community and believe in promoting the positives, encouraging engagement, and leading by example. Lipscomb & Pitts Insurance is proud to be a presenting sponsor of The Spark.